Hi everyone, welcome back to our health and wellness blog. Thank you again for stopping by. I hope that you are staying well. So this week's topic is about screen time and how it can sometimes contribute to headaches or eye strain. It's certainly not uncommon that during this time when we're all having to use screens to do our daily activities for work or for school, that parents and students may be experiencing some eye discomfort from looking at the screen for extended periods of time, or even headaches. And those who suffer with migraines may notice an uptick in the intensity or in the number of migraines that you're experiencing during this time. It's certainly not surprising, being that this has become a new form of how we're doing our day-to-day work and activities. But certainly I want to be able to give you some tips as to how you can try to minimize those symptoms should they occur. So one thing that the American Academy of Ophthalmology has recognized, the fact that looking at a screen for an extended period of time doesn't necessarily cause direct eye damage, but it certainly can contribute to eye irritation, to increased dryness and discomfort. And that's simply because we usually blink at least 15 times each minute. But when we're looking at a screen or a device, that is decreased by half to a third. And so if our eyes aren't blinking as often as they should be, then it can cause some dry eye and some eye strain. Also to note is that the blue light that's emitted from screens can also cause some headaches and eye strain as well. I alluded to this from last week's blog, in that it can decrease the production of the hormone melatonin that helps us to sleep. And so it does also affect your eyes. In within the blog, there are links to some products that you can use if you consult with your provider or your eye care provider, and they find that it may help with your symptoms. I included some links where you can read more about blue light blockers or blue light filters that may help to decrease your symptoms. So what can you do to try to decrease this eye strain or the headaches that you may be experiencing? One thing is just take a screen break, whether that's setting a timer and getting up from your computer or your device and just taking your eyes away from having to look at a screen for a little bit. Also, if you're working from home and having a lot of back-to-back video calls, suggest that maybe you call in so that you're not having extended hours of having to look at a screen or scrolling through documents. And especially if it's just three or fewer people, maybe you can do a conference call rather than a video call to just give your eyes a break for that time that you are meeting with others. Also, getting up, moving outdoors, just changing the light that you're getting, get some natural light. That way you're not getting the light that's emitted from the lights in your home or the lights from your screen. Another thing that you can do is to actually lower the brightness of your screen, your phone, your laptop. Most of them have the ability where you can decrease the brightness and the light that's being emitted, and that will try to decrease the amount of blue light that's being emitted. Also, as I mentioned before, there are blue light blockers. They come in the form of glasses. They even have them for kids where they can wear them, and it blocks the blue light that is emitted from screens. There's also blue light filters that you can actually place on your laptop screen to help decrease that light. And then a simple rule is the 20-20-20 rule. And it's actually where you set a timer and it reminds you to actually look away from the screen every 20 minutes and look 20 feet away from your screen or beyond your screen for a full 20 seconds. And it just gives your eyes time to relax and kind of reset so that you're not staring at your computer screen for an extended period of time without looking up, looking around, and having that focused time to look somewhere else. So if you find that you're experiencing persistent headaches or an increase in the amount of headaches along with eye discomfort, don't hesitate to reach out to your primary care provider via a telemedicine visit or your eye care provider just to let them know that you're experiencing those symptoms to see if there are any things that they can recommend for you during this time. It is not it's not uncommon that you would experience this during the times that we have to be on our screens a lot more than normal. But certainly you don't want it to be, you don't want to ignore it, and you want to make sure that there's no underlying causes for either of those symptoms. So I hope that this was helpful. So take some time to rest, relax your eyes and your brain. They will thank you for it. So stay well, take care, and I'll see you next time.